Today we're going to talk about sleep. I'm going to talk about the benefits of exercise and sleep. Fatty's going to touch on the sleep disorders and how we can actually help with the sleep disorders. So do you want to touch anything more on that? It's an intro, all good. You'll hear from Fatty later. The reason we kind of wanted to do this was about a month ago I did a talk on exercise as one of the longevity pillars and the benefits of muscle mass and building strength. And sleep is one of the other pillars and ties in really nicely with exercise. You can't kind of have one without the other. If you're exercising and not sleeping, you're not going to be able to build that muscle to get the benefits. And if you're not exercising enough, you're not going to sleep well either. So they kind of tie hand in hand. So if you want that recording, we'll send it through. Anyone watching along, just let us know and we can send it through as well. So let's dive in. So the main things I'm going to be talking about today is, what's the best intensity to get sleep benefits? What's the best exercise duration to get the benefits? When is the best time to exercise during the day? And then kind of the different types of exercise, cardio versus weight training. So any questions, just let me know throughout. And the main exercise dimensions we're going to talk about today is quantity of sleep, so how long you're sleeping for, the quality of sleep, kind of which encompasses how many times you wake up, the efficiency of kind of what stage of sleep you're in, and then the onset of falling asleep, so how quickly you fall asleep. Do you guys have issues with any of those?
Yeah, I do. Like how quickly I fall asleep, the duration is a big one as well.
Yeah.
And I think exercise will play a role as well, or lack of exercise, or sometimes too intense exercise before bed as well.
Yeah. How long before bed are you exercising?
Typically after dinner. So I come back from work, I eat dinner, or the other way around. So probably like 2 hours.
Yeah.
And if it's high intensity, then I know that my body still needs time to rest.
Yeah.
But that's a factor. Yeah.
Yeah, definitely. So these are the stages of sleep. So we have the awake phase, and you go through this cycle. There's two more there as well. You go through this cycle about 4 to 6 times a night, and each cycle lasts roughly about 90 minutes. And each stage is really important. So you have awake stages between, and that kind of helps your brain transition between these stages. We then have our 2 light sleep stages, and those are kind of the gateways to sleep. That helps to kind of ease your body, reduce your body temperature, and allow you to fall into those deeper stages of sleep. And the light sleep makes up about 50% of your total sleep time. These are the 2 that we're really looking at and the benefits exercise have. So your deep sleep, that's where most of your repairing happens. So if you're exercising, that's where all the benefits come into play. It's where the tissues repair, helps with immune function, memory storage, and like I said, exercise has the best benefits here. And then your REM sleep is where a lot of your kind of memory consolidation and emotional kind of long-term memory comes into play as well. Any questions on those?
What does REM stand for?
Rapid eye movement.
Oh.
Yeah. So the case for exercise. So yeah, it pretty much benefits every single part of sleep if you do it to the right amount. So 40% faster to fall asleep with some studies, and we'll go through all these throughout the presentation. 40% increase in deep sleep with the right amount of exercise. A 65% reduction in sleep problems. So that's the amount of time they're waking, feeling groggy after 8 hours of sleep, those kind of issues. And 30 to 50% increase, 30 to 50% less likely to wake throughout the night. So these are just some of the benefits sleep gets. So this particular study had 2 groups. One was an exercise group and one was a control group doing no exercise. They completed baseline testing, sleep studies, which Fatty will go through in a second, prior and then afterwards, and they also did a cognitive memory test the following day as well. The exercise group did 20 minutes of walking, followed by some basic upper and lower limb resistance training. And their sessions were moderate intensity, which is 50 to 70% off your maximum output. And they did this twice a day, so 1 in the morning, 1 in the evening. So here they found a 40% increase in their deep sleep from their baseline. So it's important because it's individual. They base each other on themselves. So they do the study, do the exercise, and then they retest themselves. So it's pretty amazing the increase that could be had. The control group who did no exercise had no benefit, and as well there was improved memory and cognition scores the following day, which makes sense because when you're falling into deep sleep, having more deep sleep, you can consolidate your memory much better. Okay, looking at intensity now. So this study was older adults over 65 exercising 3 times a week, and then there was 3 exercise groups. So we had a high intensity doing 80% of your maximal output, and a low intensity group doing 20% of your max output, and then the control group doing no exercise. So here you can see the high intensity group had a 26% improvement in sleep quality, whereas the low intensity had a 15% improvement. So you don't have to work super hard to get good benefits. Some people think the harder I work, the better I get. Yes, but you still get significant improvements just by doing 20% of your max output, which is just a walk, essentially. So I thought that was quite interesting. This is another study on intensity. This was a 400 person study. This was all women, sedentary and unhealthy weight, and they were broken up into 4 groups. So we had a control group not doing any exercise, and we had the group 1 doing 50% of the recommended exercise intensity. The recommended exercise intensity is at 50 to 70% of maximum output, which is your VO, zone 2 kind of training, if you've heard of that before. So 50% of recommended intensity and 100% of recommended intensity both had a 50% reduction in sleep problems. Whereas the group that did 150% intensity had a 65% reduction. So it's similar to the slide before, where the more intense exercise you do, the more benefit you get, but you still get very good improvements with doing lower intensity work as well. That makes sense? Any questions on intensity? How intense would you guys exercise?
It depends. I feel like if I'm going for a jog, I'd say I'm often in that 50 to 80% range.
Yeah.
But then if I'm playing beach volleyball or something, that's quite taxing, so 80% up, I'd say.
Yeah. Alright, this one's on duration. So again, sedentary adults with sleeping difficulties is what the population was. We're looking at moderate aerobic exercise, and most studies are the same. They're looking at cycling and treadmill just because it's easy to monitor. And then they're working at that 50 to 70% of max output. So here they looked at a duration of 30 minutes, 60 minutes and 90 minutes, and then saw the benefits from that. So if you're exercising for 30 minutes, you're getting a 20 to 30% improvement. For exercising for 60 minutes, the benefits increase to 35 to 40%, and that's the same in the 90-minute group. And they kind of hypothesize that you get your max benefits at 60 minutes, everything after that, in terms of sleep, you get other benefits from other things, but in terms of sleep, your benefits max out at 60 minutes. So you only need to be doing that 60-minute time.
That's about 3 times a week?
Yeah, 3 to 5 times a week is your max. Easy sweet spot.
Yeah.
Daily walking and daily exercise is very, very important, but when you're working at a higher intensity, 3 to 5 times a week is kind of where your benefits get. So yeah, from the 60-minute group, sleep efficiency increased by 8 to 12%. Time to fall asleep reduced by 10 to 15 minutes. Total sleep time increased by 30 to 45 minutes. And then the amount of times people woke during the night reduced. So 60 minutes of walking at 20% off your max output will give you some of these results. Now we're going to type of exercise, so cardio versus weight training. So cardio, again, they mostly do cycling and running. Swimming, it's just harder to test, but swimming is also included in that as well. And they found up to a 40% increase in deep sleep, similar to the earlier study that was showed. Weight training had a 30% increase versus the non-exercise. And then your walking daily showed that 30 to 50% less likely to wake during the night. Pretty much, a combo is your best bet. If you can do a walk or run followed by some resistance exercise, you're going to get your best benefit. And the reason why is you get different hormones and chemicals are released during different exercise. So during your cardio stuff's going to help with your circadian rhythm, body temperature control. Your weight resistance training is going to help with the release of hormone, like growth hormone, which is what helps to repair your muscle, and that's what's released, and that then drops you into a deeper sleep, because that's what we need to be in to repair muscle tissue. You get cytokines released as well, which also helps us fall into that deep sleep. So pretty much just choose an exercise type that you enjoy and do it consistently, because that's the main key here. If you're not doing it consistently, you're not going to get the benefits. So if you're trying to push for 90 minutes to do high intensity exercise, no one's really sustaining that. So choose a type of exercise you enjoy and just do it regularly. So yeah, this is what I just touched on before. So this is why exercise helps. So yeah, you get your cytokines and growth hormone that's released mainly with your resistance training. You also get it with cardio, but more so in your resistance. Your BDNF, so your brain-derived neurotropic factor, also released during exercise, which helps us fall into that deep sleep. Stress hormones, so cortisol and adrenaline. Exercise helps to reduce that, lessen your stress, and make you fall asleep quicker. And then yeah, exercise, in particular early in the day, will help to with our circadian rhythm. And then that kind of sleep-wake time, that's why they say go to bed at a regular time, wake up at a regular time. And then the mental health benefits, if you're up all night thinking about things or stressed, exercise has impacts on that too, improvements on that. So when should you exercise? So morning, again, different stages have different benefits, but morning generally is your best. You can kind of jump on your natural hormones like cortisol, which can kind of allow you to exercise at a higher level, therefore getting better benefits. It also really helps with that circadian rhythm. Midday and early evening are still very good to exercise. You just want to be careful of doing high intensity, as we spoke about before, too late. But how late can we exercise? So this study looked into exercising before bed, and they looked at core body temperature, heart rate recovery, adrenaline and sympathetic activation, and then the time it takes you to fall asleep. So they looked at it exercising 90 minutes before bed, 60 minutes before bed, and 30 minutes before bed. So 90 minutes, no issues with sleep, body temperature dropped to a normal level, heart rate and nervous system also dropped to a normal level. 60 minutes had mixed results, and it came down to how intense the exercise was. So if you're doing really high intense exercise, it just took you a little bit longer for your body to come back down to those normal levels to allow you to sleep. But in many other studies of kind of lower intensity exercise, your body can kind of handle 60 minutes in most people. And most people aren't going to the gym and then falling asleep within an hour of leaving the gym. So you're pretty much okay. But yeah, in a 30-minute group, yeah, body temperature stayed too high, heart rate stayed too high, and it took those people a lot longer to fall asleep. So, summing all that up, this is kind of the ideal week that you want to do to maximize your sleep benefits. So we're exercising regularly, 3 to 5 times a week. We're trying to hit 60 minutes per session with a combination of cardio and resistance exercise, and we're trying to hit that 50 to 70% of your max output. If we're going higher than that too often, yeah, you're just not going to be able to sustain it. Most people can't sustain it. So yeah, you could go for a bike ride, or if you've got a gym membership, jump on the treadmill or on the bike, and then follow that by some resistance training. If you're not in the gym, daily walking and then some easy home-based exercise will really benefit. And a lot of patients that we see here and talk to about this, they're not adding in that resistance work, and I think that's so important. That's where all those hormones are released, which help you fall into deep sleep. But when we look at longevity and living longer and having an active life, you have to be doing the resistance training to build up the muscle mass. So this is where I think all the gold is. So yeah, for people we speak to, they don't do it because they don't have the equipment, they don't know what to do, or they're getting injured. So for those that need help with it, come in and have a chat with us. We can help build that program with what you have at home, and help help you sleep better. So I'll just fly through this because Fatty's going to touch on sleep apnea in a second. But the way exercise really benefits is that weight loss, reducing weight, we know has a big reduction in the severity of sleep apnea. Improves our muscle tone, so allows our airways to stay open for longer. It reduces inflammation, so again, swelling around your airways will limit how well the air is flowing through. And then outside of just weight loss, exercise has so many other factors that improve sleep apnea. The other one I want to touch on is insomnia. So as you get older, insomnia rates skyrocket. So that's where that just daily walking gives you that 30 to 50% reduction in wake time. So yeah, that's kind of a summary on what we went through before.
Is insomnia when you keep waking up, or is when you can't get to sleep very quickly, or what's insomnia?
Do you touch on that?
Yeah, insomnia is just finding it hard to fall asleep.
Okay.
Or to continue sleep.
Yeah.
That's where the sleeping time is.
Okay.
Yeah. Yeah, and then the other benefits of reducing comorbidities. So exercise is so good at that, and that all cardiovascular risk, obesity, diabetes, and other conditions will definitely affect your sleep. So there's a bit of a checklist. I'll hand this out to you guys later, but it's just these are the things that you want to be able to do to have a healthy night's sleep. So you can just kind of work through it, and where you're missing things, you can kind of I need to be doing those. So we'll give you those in a sec. Cool. I think that's me. Any questions on any of that?
All good. Thank you.
All good? Yeah, the biggest thing is just be consistent with it. It doesn't need to be anything special.
Yeah.
Cool. I'll pass over to Fatty.